Good morning, Danny. My name is Dylan, student physical therapist.
Hey.
I'll be helping you out today.
How are you?
I'm doing good. So I know you're coming in with some pain in your quad. We're going to be using some electrical stimulation with this device to help with that pain. Does that sound good?
Yeah.
Awesome. All right, before we get started, just going to ask you a couple safety questions. Do you have any blood clots or thrombophlebitis in the leg at all?
Oh, no.
Any history of cancer or current tumors in the leg?
No, sir.
Awesome. Do you have a pacemaker?
I don't, no.
Awesome. Do you have any unstable heart rhythms or anything like that? Awesome. And then you're not pregnant, are you?
Not that I know of.
All right, well, check that one off of the list. I'm just gonna check the sensation in the leg. Okay, if you feel these taps, you're just gonna tell me yes, all right?
Yes. Yeah. Yes. Yes. Indeed.
Seems good. Check the blood flow into the area. It's looking good. Pigmentation seems intact. So before we start, I'm gonna apply some alcohol to the leg just to clean it off. Okay, it might be a little bit cold. And we're just gonna apply this in the areas where the electrodes will go. So for interferential current, we're going to use 4 electrodes, and we're going to make sure that the channels cross and center in this area where he's having the pain. So channel 1 here, and we're going to make sure the electrodes are generally in line with the fibers of the muscle. So for the quad, runs generally in this direction. All right, and then we'll set up the parameters on this machine. All right, so we start by selecting electrotherapy, and then we'll select manual operation. We want to select the IFC button here from all the different protocols we could use. And then this is asking what channels we're using on the machine. We're using channels 1 and 2 here, so we'll select this top button. We're gonna leave the carrier frequency where it is and the high and low beats where they are. The vector scan, we're gonna change to automatic, and we're going to raise it to 100%. What this is going to do is continuously change the area where the currents are intersecting so that we try to stimulate a larger area of the tissue. From here, we'll set the treatment time to 10 minutes, since this is only part of our treatment. And then this is the intensity that we'll set, and this is based on patient tolerance. So we would be asking the patient, let me know when it gets too much. As soon as they say it's too much, we would then drop it down just below that. And as you can see, our time has started. Oh, he's alive. Okay, just checking. All right, so what we're gonna do now is take off the electrodes. I have stopped the machine. This might be a little uncomfortable. Okay, we'll replace them so that we can save them and make sure we use the same pads every time. Some patients might be a little bit sensitive, you know. It's like a Band-Aid. Hey, we made it. Typically, this is more uncomfortable than the treatment. Treatment should not be uncomfortable at all. And we'll inspect the skin where the electrodes were for any redness, any irregular discoloration that we might see. Everything's looking good. I can check sensation again and the blood flow to the area. It's looking normal. How's your pain right now?
I feel fantastic.
Feeling better?
Well rested.
Awesome.